Welcome, everyone. I'm Sulma Arias. I'm the Executive Director at People's Action and the People's Action Institute. We are a national network of grassroots groups with more than 1 million members in 30 states. And this is Care Over Cost, Cover Our Care. Thank you for joining us tonight. Muchísimas gracias por acompañarnos. Si quieren seguir nuestro programa en español, sigan el link en su pantalla Somos Más. If you want to follow our program in Spanish, use the link on your screen, Somos Más. I'm so glad to be with you all tonight. We believe everyone deserves quality healthcare, yet private insurance often denies our care when we need it the most. Many of us find out only when we get sick that private health insurance does not help. They deny, delay, and refuse our claims. As you'll hear from our guest tonight, this is a crisis, and it is a matter of life and death. Private companies hold too much power over our lives and over everyone's lives in this country. That's why 2 years ago, we launched Care Over Cost, a campaign to help patients get the care they need when they need it, and to change the system that keeps us from getting care. At People's Action, we believe people like you and me, when we organize peacefully and effectively, have the power to change the world. We reject all forms of violence and anyone who supports it. Yet, our healthcare system, as it stands, also causes harm. That's why we must change it. Tonight, you'll hear from people, patients, doctors, and nurses who courageously answer the call to become change makers. Through peaceful public action, they draw attention to their own pain and to the solutions we need. So thank you. Thank you to Carly, to Sarah, to Alicia, Patty, Mindy, Laura, and Matt, and to everyone who, through Care Over Cost, is working to win the healthcare we all need. We invite leaders in healthcare and our elected officials to listen. Listen the way we will all listen tonight. Listen to our denials of care and how they affect nearly every family in America, and why we need the change now. We need common sense solutions, and we will always engage in constructive dialogue, but we will not rest until every one of us gets the care we need. With that, let me turn it over to Aija Nemer Anarud, who is our director of our Healthcare for All campaign and Care Over Cost. Welcome, Aija.
Thanks, Solma. I'm Aija Nemer Honorud, Director of our Healthcare for All campaign at People's Action Institute, and I'll be your MC tonight. So before we get started, I wanted to thank all of the organizations that have supported this event and who we've been organizing with side by side. Over the last couple weeks, as y'all have seen, there's been a huge outpouring of anger and heartbreak online and in the media about the pain that private insurance companies cause. I would bet that everybody watching this knows this pain personally, whether it's from going through a care denial ourselves or having to watch a loved one struggle through it. I personally was denied hormone replacement therapy multiple times by my insurance company, BCBS, just last year. These insurance companies exist to make money, not to get us the care we need. That's why I was arrested this summer in a peaceful protest with 10 other people, some of whom you'll meet tonight, at UnitedHealthcare's headquarters. Over the last decade, policy solutions to the crisis that is our healthcare system have focused mainly on expanding coverage, making sure that as many people as possible have health insurance. Unfortunately, not as much attention has been paid to whether that coverage actually allows you to get the care that you need when you need it. That's why we started the Care Over Cost campaign. We were hearing from members around the country that they had insurance but still couldn't get the care that they and their doctor agree they needed. Sometimes when this happens, it's because of a prior authorization denial, where the insurance company blocks you from getting care. And sometimes it's through a claim denial, where you've already received care and the insurance company refuses to pay for it, leaving you in debt. Care denials happen over 248 million times per year. 248 million. That's frequent enough that almost every family in this country can expect to have a care denial every year. And it happens on every type of private plan. Employer plans, ACA marketplace plans, privatized Medicare, known as so-called Medicare Advantage, and privatized Medicaid, known as Medicaid managed care. And the effects are worse for people of color and people in rural America We're often sold worse insurance plans and left with fewer options of providers. So that's enough about the problem for now. Let's meet some of the members of Care Over Cost and talk about how we're fighting back. First up, we're going to show you a quick video from Carly, who had life-saving care denied by UnitedHealth and fought back with us. Let's roll the video.
I had been fighting my medical issues in my insurance company off and on for more than a year. I cried and screamed and requested of supervisors. They made it impossible. I thought that that was the end of the road. I'm not getting the surgery, so there's not much of a chance for me. We reached out to People's Action, and they gathered together around me and helped me fight my insurance company. And then when that change happened, it was like all this hope just went inside of me. And I felt not just hopeful, but I felt like I had, because of what I had survived and experienced, the special kind of power and energy in me, pushing me to make things different. I want it to be different for everybody.
My name is Doyle, and I'm with Progressive Maryland. I stand today for clean air.
My name is Stephanie Johnson, and I'm representing Vocal Kentucky. And we're fighting for political power. And that is why we are launching the Organizing Revival.
Hi everybody, my name is Carly Morton and I'm really excited to be here today. Every person should have free access to high quality health care. This is a human right, and this is why advocating for change is so damn important.
Appreciate it, Aja. My name's Robel Warku. I use he, him pronouns, and I'm the Healthcare for All lead organizer with the People's Action Institute. Back in 2018, Kaiser Permanente denied my care after fluid leaking from my skull left my brain sagging too low and incapacitated me. I got the treatments I needed, but I got stuck with a massive bill afterwards. Like Aja and Sulma said, we keep hearing stories like these from our members, and so we launched the Care Over Cost campaign. We'll play a quick video here.
The health of every person matters. Regardless of our race, how much money we make, or what zip code we live in, we don't turn our backs on people in times of need. So how is it that in the richest country in the history of the world, you can lose everything if you or a loved one gets sick? Greedy executives at private health insurance corporations make life-altering decisions for the rest of us by refusing to pay for care when we need it most. This is called a claim denial or a prior authorization denial, and that adds up to billions of dollars every year. When your claim gets denied, one of two things can happen. One, you don't get the care you need because you can't afford to pay, or two, you do get the care, but then you get stuck with enormous medical bills that could force you into debt or even bankruptcy. And if you want to appeal after you've been denied, you can go through a time-consuming process that the insurers intentionally make hard to navigate. So in the end, just over 0.1% of people appeal claims when they are denied. This practice hurts all of us, but especially affects Black and brown people, who are often sold the worst insurance, and people in rural America where there are fewer healthcare providers or none at all. Why do companies behave this way? Short answer, it's how they make money. And the more they refuse, the more they profit. More money for CEOs and Wall Street investors, and less care for you and the people you love. So what can we do about it? Organize. People's Action's Care Over Cost campaign organizes people nationwide to appeal and overturn wrongful insurance claim denials from private health insurers and expose the lie that corporations are here for our health. And we know that when we organize, we can win. We won't let greedy companies keep calling the shots when it comes to our health. We're fighting to build a world where everyone gets the care they need when they need it. Join us. Visit careovercost.org to get involved.
So our solution is organizing. If insurance companies won't listen, we take the message to them. Always peacefully, but we won't rest until all of us get the care we need and deserve. The central goal of Care Over Cost is to get insurance companies to stop denying care. And so we've built an infrastructure to fight for and with people against corporate insurers. Our national appeals team is a team of folks who have specialty in contract law or who have worked in the healthcare industry and have had to fight for their own care or the care of the people they love. They help guide people through the appeals process because private insurance companies count on you to not appeal their denials. But that doesn't always work. So sometimes we have to take those fights public. Because while insurers may not care about covering your healthcare needs, they do care about their image. Whether it's a treatment or procedure that you can't get because of a prior authorization denial, or folks who are getting stuck with a massive bill after the fact, we've waged several public campaigns with folks that are fighting to get their care covered. We launch online petitions, pressure local elected officials to join us and advocate for folks, and have even brought our communities together and gone to the doorstep of insurance company headquarters to make our demands clear, that they need to stop denying care. And we've won. But we can't do that hundreds of millions of times. The problem is bigger than any individual denial, and it's bigger than any one insurance company. UnitedHealthcare takes advantage of us, but we've gone toe-to-toe with all the major private insurance companies because all of them are gaming our system. We need to change this whole dang thing, which is why we do this all across the country. Our campaign is made up of several local and state-based grassroots power-building organizations that are working to transform our healthcare system both within their states and nationally. And pressuring our elected officials to act is crucial because these corporations aren't going to upend their entire profit model. And trust me, we've tried. We met with key executives from UnitedHealth Group and their subsidiary companies. And while they were willing to resolve some of the cases we brought to them, they didn't agree to a single one of our structural demands to change their practices. They will not reform themselves. They have too much to lose. But we have even more to lose, which is why we need our elected officials to act and to make sure these corporate insurers stop denying care. Like Aja mentioned earlier, Black and brown folks are sold the worst insurance, while folks in rural communities have limited access to care. But care denials impact all of us. This isn't a left versus right issue. This is a top versus bottom issue. It's billionaires, rich CEOs, private equity, and Wall Street against the rest of us. And so we can't afford to go it alone. Back to you, Aja.
Thank you, Rebel. Now I'd like to introduce Sarah Mari Flores. Sarah is a leader with Missouri Jobs with Justice and is going to share her really emotional story of being denied care by Anthem-based CBS and fighting back as part of the Care Over Cost campaign. Take it away, Sarah.
Thank you, Aja. My name is Sarah Mari Flores. I'm a community health worker, doula, a mother of 3. This is the story about the birth of my 3rd child and the $6 billion profit-making insurance company called Anthem Blue Cross Blue Shield. In March of 2023, I was pregnant with my 3rd child. I had planned on a home birth, but because birth is totally unpredictable, my birth team and I had planned on going to a hospital that would be totally in my insurance plan with Blue Cross Blue Shield. The rules for my insurer were supposed to be predictable, but instead, it wasn't. Ended up having to transfer after 4 days of labor into the hospital. As soon as my baby was born, he struggled to breathe. I heard gurgling instead of the loud cry I was expecting. It was really scary. The NICU team came and totally whisked him away. I barely got to hold him. And it turned out that he had a pneumothorax, which is a hole in his lung. I was so grateful, and I continue to be grateful for that decision to go into the hospital because we got life-saving care for my baby. We ended up staying in the NICU for 3 days. Mind you, many families in the NICU end up staying much longer. So I consider our 3 days in there a blessing. We ended up leaving with a very strong, healthy baby, and I was overjoyed. 9 months later, you could have knocked me over with a feather when I got a bill for about $14,000 for not the NICU stay, but the providers in the NICU. That would be the nurses and the neonatologists. How in the world was my family and I supposed to look up and see if the neonatologist in the NICU was in my plan when I was in labor? It's absurd. They said that they were out of network, and so my family and I were on the hook. We could not afford that. We're a middle-class family of 5. Along came bill collectors, but also along came help from the diligent staff. Cost. They spent many hours with me to navigate the many layers of obstacles in Anthem Blue Cross Blue Shield and the bill company for the neonatologists. We came up with a strategy that included essentially shaming Blue Cross Blue Shield into at least talking to us. So we created an online petition and a video of my story and my baby's story. It ended up shaming them. It worked. But I still cannot get over the fact that not only did they say, oh, it's in network now, they completely covered it like they turned off or on a light switch. So I just want to compare the fact that my $14,000 bill, which is completely unaffordable for my family, is contributing to the wage of Elevance CEO, the parent company of Anthem Blue Cross Blue Shield. Her name is Gail Boudreau, and she was paid $21.8 million in 2023 alone. She's making money off of denying payment to families in the NICU, their babies. While UnitedHealthcare may be the best at denying life-saving care in the nation, Anthem Blue Cross Blue Shield is making $6.6 billion in profit in 2024 alone by denying care to families in the NICU. My family suffered so that Gail Boudreau could make $21.8 million despite that. Despite the rigged game that these giant health insurance companies play on us, my family was able to persevere with the help of the Care Over Costs team. There is hope. If an average family like mine, with a team of volunteers and a small staff, can win against these millionaire CEOs, so can everyday people caught in the same rigged system. We can make a change together. Back to you, Aisha.
Thank you, Sarah. Obviously, you never should have gone through any of that, but I'm glad that you've come out on the other side with a healthy baby, your bills covered, and continuing to expose the harm that these insurance companies cause. So if you or a loved one have dealt with a care denial and want to share your story with us and help spread the word about the way these insurance companies are making people suffer just to make a profit, please share your story with us by following the link at the bottom of your screen. Now, I'd like to introduce 2 more of our Care Over Cost team members, Patty Sneed from Progressive Maryland and Mindy Salango from West Virginia Citizen Action Group. Patty and Mindy are the co-chairs of our campaign, and they've both done a ton to fight back against insurer greed and make sure that we can all get the care that we need when we need it. So take it away, Patty.
Thanks, Aisha, for that introduction, and thanks for all the great work that you do. And shout out to the People's Action entire team for bringing so many people together tonight. And good evening, everyone. My state organization is a part of the People's Action Network family. We organize everyday Marylanders to push local and state lawmakers on healthcare issues like providing essential medical services in our communities, lowering the way too high cost of prescription drugs, and expanding access to care. We talk to people at their doors and at community events and online. And one of the biggest concerns people have been bringing up these past couple of years is health insurance denials and their problems with health insurance plans. So I'm just going to take a few minutes to describe the national campaign that Robel mentioned, our Care Over Cost campaign. It's really one of the most important efforts my organization has ever been involved in, and we hope that you'll join us wherever you live. In Maryland, the 2023 annual report that our Attorney General's office issues showed that there was a 78% increase in denials in the previous 5 years. 78%. Their office, we love them, try to help people with cases, but they have limited resources. As Robel said, we've been helping people with our appeals team nationally with their appeals. And even though we've won some, as he said, we can't do that for millions of people. The best way to deal with this problem is by going directly to the source, the corporation's headquarters, where they're making these terrible decisions about our care. We started with Blue Cross Blue Shield, Sarah. It's a huge insurance network. 100 million Americans get their health insurance from that network. BCBS is also Anthem and now Elevance. We wrote to the leadership at BCBS about the pain you're hearing about tonight that their denials were inflicting on people, and we asked for a meeting. They ignored us, so we asked people to go to their national headquarters in Indianapolis. 80 people said yes, and we showed up in person at their offices in November of 2022. And we have the receipts, as you can see from the photos from that action. They wouldn't agree to help anyone who shared a story about what they were going through or to change a single business practice. Our response to that response, show up at more of their offices. And that's what we did. In the spring of 23, people turned out to several BCBS offices. We went to places like Cedar Rapids and Syracuse and Marquette in Michigan. Reporters came out to cover the events, getting us good press coverage around the country. And that peaceful protest in Indianapolis and the additional locations were getting good play and bringing more public attention to the problem. Each time we did these actions, no matter where we were, no matter the location, we delivered letters laying out simple demands and requesting that company officials meet with us. We were serious about this, but they had no interest in talking with us. We know their arrogance comes in part from the power that their corporations hold and wield in our political system. They buy their influence by giving millions of dollars in campaign contributions and by hiring an army of lobbyists to work around the clock for the policies that they put together, that they write. That's how we end up with rules that favor insurers and allow them to keep buying up more and more of our healthcare system. Now they control big parts of good public programs like Medicare and Medicaid, thanks in part to their trade association, their umbrella group called America's Health Insurance Plans, or AHIP. AHIP has gone all out to persuade lawmakers that Congress should give their privatized Medicare Advantage plans, or Medicare Disadvantage, more money than traditional Medicare. And Medicare Advantage plans now have a much higher percentage of denials than traditional Medicare. This group, AHIP, has its headquarters in Washington, D.C. We decided we should pay them a visit and that we should bring a lot of people with us. So last summer, about 1,000 everyday folks marched through the streets of DC to their offices. People who needed care, like Carly, spoke up to share their stories and demand that AHIP tell their members to stop denying and withholding our care. This time we got a meeting with one of their vice presidents. Everyone who was there that day who participated vowed to go back home and get more people in their states involved in the campaign. We used our momentum to stage a big national day of action in the fall. In October, 15 groups from blue states and red states, Maine to Kentucky, Colorado to West Virginia, spoke out at the offices of healthcare giants like Blue Cross Blue Shield, and then UnitedHealthcare, Cigna, Humana, and Aetna. Here's a video of the action we held here in Maryland.
What good is my insurance if I can't use it? If Care First doesn't approve what my doctor says I need.
Stop the greed.
That's why we came out today.
Stop the greed. Support our needs. Stop the greed. Support our needs. Stop the greed. Support our needs. Stop the greed. Support our needs.
Today, we have a couple of community members, people like you and I, who want to share their stressful, traumatic, and difficult dealings with Care First.
By September, I was receiving bills that were $30,000 or more. Care First's office aren't open during the evenings or on the weekends.
Right.
Ultimately, it took over a year, to resolve the billing with Care First.
Care First, you can't hide. We can see your greed inside. Care First, you can't hide. We can see your greed inside. Care First, you can't hide.
This doesn't just affect older adults, it affects our children too.
By this time, almost a year had passed with my son suffering every single day with pain and no relief. Care First didn't want to approve the Humira first. It took my doctor writing letters and spending countless hours talking to them to get approval. But since then, I've had to fight for them to approve the medication every single month.
Why should you be the deciding voice as to whether or not we live, die, or receive care?
Who are you? To decide. If we live. Or if we die. I believe that we will win. 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 I believe that we
Action. So did everyone who was there. And this video. Thanks to John and the team who helped capture the story of what we did that day. It's folks like the people you've been hearing from and seeing tonight who really power this campaign. Now, my friend and campaign co-chair Mindy, who inspires me every day, will tell you about what came next. So over to you, Mindy.
Oh, thank you, Patty. And you are a powerhouse and definitely an example for me. So thank you for all the work you do in Maryland. I came into this work as a patient and storyteller who was forced to ration insulin for a year due to pharma and insurance greed. I was just a single mom with a story who didn't want anyone else to suffer as I had. I'm proud to have found People's Action, and now I'm the healthcare organizer for West Virginia Citizen Action. My work is centered around empowering others to share their stories and use their voices in concert with some of the ones you will hear today to shift power away from corporations and back to the people. Now back to the insurance companies. Some of the most extreme cases of denial were found through UnitedHealth. People who would die, UnitedHealth kept denying their care. We helped them fight back, but the more we learned about the corporation, the more we found that they took more profit than any other and denied more care than any other corporation in America. In March of 2024, we held a live stream regarding UnitedHealth specifically, with people talking about problems with denials and delays of care. We knew we were onto something when 70,000 people joined us. We sent UnitedHealth executives a letter asking for a meeting, so they refused to meet with us. This April, over 100 of us, including UnitedHealth members, held a demonstration in the United Healthcare lobby. We told stories of being denied care and demanded that they meet with us. We also delivered a demand letter. Here are some of the examples. We asked for them to stop denying claims and overturn any existing denials for treatments recommended by medical professionals. Hold quarterly open microphone meetings with policyholders to discuss problems with your insurance products in each state you sell insurance in, just as you hold public meetings with your shareholders to discuss their profit. Cease overriding the will of the people who will need health care by lobbying and donating your members' money to politicians' campaigns, PACs, and any other entities that can advocate for or against the defeat of elected officials. Sounds pretty reasonable, right? Instead, they called the police on their own members, holding a sit-in and risking arrest for them to agree to meet. Let's take a look at what that protest was like.
We are health professionals, workers, retirees, health justice activists, and all of us are patients. We are here today in your lobby because everyone should have access to quality health care, regardless of their race, gender, or where they live. Hot off the press from this morning, UnitedHealth reported a revenue of $99.8 billion for the first quarter of 2024.
I'm here to show solidarity because I suffer from being covered by my health care and inadequate health care, just like the folks here in Minnesota are, and every state across the nation. And we have traveled from all over today to come out here and share the message that we need to put people over profit. Healthcare is a human right, and we're not going to take it anymore. We're here to fight.
What is our goal of being here today? Well, that's simple. Our goal is to demand action and accountability. We are here to demand that your unscrupulous practices of denying medications and care to patients you serve ends now. We demand UnitedHealth Group take the following steps to remedy this situation. Execute a publicly shared audit and reimburse the federal and state governments for the public money they diverted by claim and prior authorization denials within Medicaid and Medicare Advantage.
This isn't right. This is not health care. It's killing people. It's putting them in situations where their health is becoming worse, and we have to stop it. It's all because of profit and greed, and it has to end.
I'm sick of losing my friends. I've spent the last year begging you for a $600 infusion to treat the most painful disease known to modern medicine, CRPS, complex regional pain syndrome, the suicide disease. Let me tell you, a year ago while UnitedHealthcare was celebrating over $8 billion in first quarter profits, I was selling the last of my belongings that had any value. Now I'm standing in your lobby. Do you hear me now? I don't want to die. Do you hear me, UnitedHealthcare?
Your greed makes us sick. Your greed makes us sick. Whose side are you on, my people? Whose side are you on? We on the people's side.
We have a set of demands for UnitedHealthcare Group we have shared. So far, they have not been listening to us. So we are also calling on our elected officials. If UnitedHealthcare Group and other insurers won't make these changes voluntarily, it is up to our elected officials to protect us.
We have a commitment from the Corporate Communications Director for the Healthcare Group, the parent company for all of these companies, this whole complex, to be in touch with us within 5 days to set up a meeting with our members to hear our stories directly.
The situation where a private company that makes money off of our health can make the decisions about what kind of care we get is an injustice, and we need to bring that message clearly to United, clearly to elected officials who can make decisions about the laws governing these companies, and to the public to help people know that the harm that they're experiencing at the hands of these companies is not their fault, and we can actually fight back.
So finally, we secured a meeting with key executives. While we negotiated around that meeting, UnitedHealth, through its Change Healthcare subsidiary, broke the payment system of tons of hospitals, therapists, and the like, people who actually deliver care. And their CEO for UnitedHealth Group was called before Congress to explain the company's actions. So we showed up there too, who wanted to meet with Sir Whitty to share their stories of care denials. Sir Whitty blew them off, people with assistive walkers and canes, and they let other staffers to hear their stories of suffering. How mad and Republicans were at Whitty. In June, a group of 14 of us, including Matt and Alicia, who you'll hear from in a minute, United executives, including the CEO of Optum Rx, their pharmacy benefit manager, that denies people's medicines, and their chief medical officer. These are the people with the power to stop denying our care. While as a result of the meeting, they did reverse specific care and denials of payment in some individual cases, they refused to agree to any systemic reforms. We sent them another letter demanding reform. Still, no response. So in July, with those demands unmet, we held a demonstration outside of their headquarters. 11 people engaged, including myself, in nonviolent civil disobedience, and we negotiated arrests with the police. These are people who have seen the impact of care denials on their lives, loved ones, and on their patients. We've asked United Healthcare to talk with patients like me and to take real steps with common sense reforms to provide better care. But they refuse to listen. Back to you, Aisha.
Thank you, Patty and Mindy, for telling the story of our work here and for everything that you do day to day with this campaign. And just as an aside, revisiting the story of our work together over the last few months, like as y'all have told it, has just made me feel very proud and also angry all over again. So again, if you or a loved one have dealt with problems getting care because of your insurer, share your story with us. The link on the bottom of your screen. Now, as promised, we're going to turn it over to Carly live to give us an update about how she's doing and tell us a little more of her story. Welcome, Carly.
Hi there, my name is Carly Morton, and I have experienced the depravity of our country's healthcare system firsthand. I'm here to share my own experience with health insurance care denials. In 2022, I became critically ill and was diagnosed with neurogenic median arcuate ligament syndrome, and MALS for short. I had not been able to eat properly in years, and I was incredibly ill. Without treatment, I would suffer severe pain and would not be able to eat for the rest of my life. I would likely die within the next 5 years. And even if I'd lived, I'd be dependent on artificial feeding and could not thrive. The only cure for this was an open stomach surgery, a rare one. The surgery would allow me to eat again and I would live. But my health insurance company, UnitedHealthcare, denied the prior authorization for my surgery. I spent hours crying and demanding help from UnitedHealth customer service agents who never offered any real assistance. Trying to navigate all of that while I was so sick was practically impossible and caused me significant mental distress. After months of trying on my own, I got connected with People's Action and Care Over Costs. The UnitedHealth appeals and prior authorization processes are so confusing that I had to work with a retired insurance lawyer on their national appeals team to file appeals. Care Over Cost ran a massive public pressure campaign with videos and thousands of petition signatures. We even got a US Senator's office to lobby on my behalf, and as you saw, I spoke out in public in Washington, D.C. Because I spoke out and because people I didn't even know cared enough to stand with me, we pressured UnitedHealth and we won the prior authorization for my surgery. Because I got the surgery, I'm able to eat again, and my chances of dying in the next 5 years is reduced. I really enjoy eating now that I actually can, especially sushi and tacos. It's deplorable to me that UnitedHealth wanted to deny me the ability to eat again just so they could add $50,000 to the $22.4 billion in profit that they took that year in 2023. I'm on a UnitedHealthcare Medicare Advantage plan. That's a privatized version of Medicare, and UnitedHealthcare is using taxpayer money, and instead of using the money for care, sending it to their Wall Street shareholders. I'm so glad that we fought and won the pre-authorization for my surgery. But here's the really bad thing. Even though UnitedHealth did end up pre-approving the surgery, after I got it, they still refused to pay the bills. My doctors were left unpaid, and I was left wondering if I'd be stuck with the bill. It was not until we pressured UnitedHealth again by protesting at CEO Andrew Whitty's US Senate hearing, where people risked arrest to land a meeting with UnitedHealth officials, that the bills were finally taken care of. In fact, after the private meeting where we voiced our complaints and told our stories, the bills were taken care of incredibly quickly. It is frustrating beyond belief to me that it could be that easy after having to fight for it so hard for so long while being so sick. I am not alone in what I went through with my insurance company. I am one of many individuals who have or currently are suffering because of care denial related issues with greedy health insurance corporations like UnitedHealth. And additionally, I am not out of the woods. I have many other chronic health conditions and I'm always going to need care. Sometimes I will even need intensive care. And as things are now with America's healthcare system, I will always be at the mercy of these insurance companies and whether or not they decide to approve my care. And that ain't right. I'm here to tell you that we need to keep going public about the serious harm that the health insurance industry is causing us. We need to stand together, and that's how we can defeat these companies. That's why I want to organize with every one of you to force these insurance corporations to stop denying our care. Okay, Aisha, back to you.
Thanks, Carly. It's been incredible seeing how you've been able to progress since you've had the surgery, and honestly, it's been a privilege to be able to work with you to get it secured. So I'm glad to be in this work with you. Fight to make sure that nobody else has to go through what you did. That being said, we know that currently in the world we have now, this is happening to other people around the country every day. So if you or a loved one is dealing with a care denial right now and wants support in fighting it, share your story with us at the link on the bottom of your screen, and we'll try to help. We rely on a lot of volunteer capacity, so we can't make guarantees, but we will support where we can. Now, many of our volunteers are doctors, nurses, and healthcare professionals who know all the ins and outs of care denials and want the system to change just as much as we do. So I'm going to turn it over to one of those volunteers now, Laura Sandoval Adams. Laura is a nurse and a leader with Center for Health Progress in Colorado. Welcome, Laura.
Welcome, everyone. Thank you, Aisha. As healthcare professionals, we know our system is broken. Here is how we try to help people like Carly get the care they need and to transform the whole system so these insurance companies stop denying our care. As a registered nurse performing acute and home health care for over 2 decades, I learned the impact of insurance denials on patient healthcare outcomes. It sadly became a predictable and alarming part of not only the patient experience, but also the work we do as nurses. Quickly, I learned that many patients would have to pay out of pocket or forego needed medical care due to insurance denials. Most frustrating for both patient and nurses was a lack of transparency. Insurance denials defied medical logic, and it would take long periods of time to discover why a working medication, needed treatment, or procedure was denied. This would create a cascade of problems for the patient, such as increased pain, cancer spreading, delayed wound healing, medication side effects, immobility, and often rehospitalization. The denial of essential care made people sicker or stayed injured longer. Sometimes they died before their time. For the nurse and other healthcare providers, insurance denials increased our workload in a field that already faces staffing shortages. The extra time I had to spend navigating insurance bureaucracy, advocating for patients, and appealing denials was an administrative burden that detracted from direct patient care. While it is disheartening for us as nurses, it impacts the mental health of the patient, who is already facing physical distress. Often I'd have a patient so depressed from insurance denial issues that I would have to recommend a behavioral health consult, hoping in the back of my mind that their insurance would cover it and the needed mental health treatment not be denied as well. Since retiring from nursing, I joined the Center for Health Progress here in Colorado and their mission to help individuals fight for care when insurers deny treatment and hold these corporations accountable. I am on our national appeals team for care over cost. When your care is denied, your insurer owes you an explanation. You have the right to appeal your insurance's decision to deny you care. These appeal processes can be hard to understand and time-consuming, but they don't have to be. People's Action Institute's Care Over Cost organizers have teams of dedicated staff and volunteers who can help you understand your insurance policy, guide you through the appeals process, and give you the best shot of getting the care you need by filing a thorough appeal and organizing community support. We cannot promise that we can help everyone or that if we do try to help that we'll win you the care you need, but through the power of sharing your stories, we can sometimes win people the care they need. If you have a story of being denied care, and if you'd like to explore joining our volunteer national appeals team, please follow the links you see on your screen.
All right. Thank you, Laura. We're really grateful for your expertise, compassion, and persistence in fighting these denials. And like Laura said, our national volunteer team needs more capacity. So if you can follow the link on your screen, or you can text us too. Don't worry, we'll share all this info in the chat and again at the end of the program. Now we've got one last person on deck to tell us about their experience being denied care. And I'm going to turn it over to Alicia Bellamy, a leader with Center for Health Progress in Colorado. Welcome, Alicia.
Thank you, Aisha. Good evening, y'all. I'm here because I suffer from diabetes. UnitedHealth denied and delayed the medicine I take to keep that diabetes in check. Millions of people suffer from this, but let me tell you, diabetes is no joke. My kidneys have failed as a result of it. I've got neuropathy, that's where your hands and feet go numb. I've accidentally cut my feet, and because of my diabetes, my my wounds don't heal quickly. I'm on a medicine that prevents those problems. But earlier this year, when I went to the pharmacy, I was told my insurer, UnitedHealth Group, denied my medicine. They said I needed a prior authorization, even though I was already taking it. Has this happened to y'all? Let's see it in a chat where an insurance company tells you you need prior authorization for a medicine that you are already on. I was off my medicine for 2 weeks as a result of UnitedHealth's delays and their denial. After numerous calls to them, they finally greenlit my medicine, but they put my life at risk. Through their delay in knocking me off my medicine for 2 weeks, you can get strokes, heart attacks, and go blind if your diabetes is untreated. What really makes me mad is that this company took 22.4 billion with a B in profit last year. That's money we all pay them to insure us. But for me, they denied and delayed my medicine. I guess they really do put their profits over people like me. Worried this might happen again, I started organizing with Center for Health Progress here in Colorado and People's Actions Care Over Cost campaign. I was at the demonstration in Minnesota at UnitedHealth Group, where I told my story in their lobby, and we demanded they meet with us and won that meeting. I felt powerful. I went to DC and tried to tell the CEO for UnitedHealth Group, Sir Andrew Whitty, how his company treated me and people like me, but he blew us off. Then I attended the meeting we got with UnitedHealth executives, the people with the power to stop denying our care. We told them that their care denials violate the trust patients place in the healthcare system and also the Hippocratic Oath, which prioritizes patient care over profit. They told us their mission was to help people live healthier lives and help improve the health system for everyone. But then they refused to make even the most simple changes, like meeting every quarter with people insured by them to hear our concerns. It's like they meet quarterly with their Wall Street shareholders. So we told them their mission is a lie. Their real mission is to make and take money we need for our care and send it to people who are already rich on Wall Street. So I'm here to tell you, we need our elected officials to act. These big insurers like UnitedHealth profit by denying our care. We need our federal government, members of Congress, state legislators, all of them to force these insurance corporations to stop denying our care.
Thank you, Alicia. I know your story well at this point as we've worked together, but every time I hear it, it makes me angry all over again. So if you have a story like Alicia, unfortunately many of us do, or a loved one has a story, share it with us at ppls.ac/share. Now for our final speaker of the night, we're going to hear from Dr. Matt Hoffman. Matt was part of the team that met with the UnitedHealth executives in June and had a lot of powerful things to say to them. So I'm glad that he could be with us tonight to share them with all of us too. Welcome, Matt.
Hi, everybody. I'm happy to be here with you all. I want to share my experience on the ground. I'm a family doctor. I work with patients every day and see care denied, see care withheld from patients. Our healthcare system is not designed to take care of patients. Our healthcare system is designed for profits for CEOs, for executives, certainly for insurance executives. We've heard from people that care has been denied. What we don't hear about, and I see every day, in addition to these denials, is people that don't use the health insurance they have because they're afraid they won't get the care, or they know they won't get the care they need. They know that the medicine they need isn't covered, so you never even hear about it being denied. I think the problem is drastically underreported. When I became a doctor, I think my goal, like most people that become doctors, is that I wanted to work with patients directly. I wanted to collaborate with patients in an exam room to decide what care they wanted, what care they need. Unfortunately, I'm not able to do that because insurance companies, insurance executives step in the way, and they say the care that we decide is important is not the care that the patient needs, is not the care that they can get. I see no benefit of having an insurance company step in the way of a decision that is made with a patient and a healthcare provider, but that's what happens every day. We've heard these examples. Every day I deal with medicines that aren't covered, medicines that are denied, people that don't get the care they need. I was able to tell the executives directly to their face about these examples. I told them about a patient that came to me with chest pain, a patient that we were both worried was at risk of having a heart attack. I ordered a test called a stress test. This was denied. This would be a test to tell, is this patient having a heart attack? The executives didn't care. They listened, nothing changed. They're not willing to make any systemic change. What I see in executives in healthcare, the people that become executives do so because they're willing to sell out patients. They're willing to take profit for themselves and deny care to people that need it. I got involved with People's Action because I feel like I can't take it anymore. I can't take constant denials. I can't take being dictated by insurance companies what care they think is appropriate for patients. They're not going to listen. The insurance companies aren't going to listen. They're happy to take profits. They're happy to watch patients die and suffer for their profits. We have to put pressure on our elected officials. We have to put pressure from the outside on these companies. From what I see, I think everyone listening has either been denied care, has not got care they need, or has seen a family member denied care or not given the care they need. This is a universal problem. This is something that affects almost every American. And I believe that the answer is that we need people to step up. We need those people that are denied care, those people that watch their family members denied care, work together, talk to their elected officials, talk to people to put pressure on these companies. I got involved in this campaign because I believe we can make change, but the change is not going to be made by insurance companies deciding to do the right thing. The change is going to happen because we as people decide to work together to fix this system.
Thanks, Matt. Appreciate you continuing to speak truth to power. So to close us out for tonight, I think that we're all here because we know our healthcare system does not work for us. It only works for the billionaires who get rich off of keeping us sick and injured. Private insurance serves no purpose. It only entrenches the already wealthy executives and sends money that could have paid for our care to Wall Street. And unfortunately, we're at a huge risk of this problem getting worse. We have people coming into office next year who have vowed to privatize our entire Medicare system and put it in the hands of the same greedy executives who denied care for Carly, Alicia, Sarah, and millions of others. But the good news is, we can win if we fight back. Just yesterday, fight against Mayor Adams' attempt to force them onto so-called Medicare Advantage, privatized Medicare, the same program that denied Carly's care. And today, companies like UnitedHealth and Anthem can make the decision to stop denying care. Our elected officials that regulate these companies can make the decision to make them stop denying care. We need to get these greedy insurance companies out of our healthcare system and rebuild one that's truly public. No shareholders, no executives, no one looking to make a buck by denying our care. Now, at People's Action, we believe turning our private pain into public action together is how we make change. The insurance companies count on us staying isolated. But as we've talked about tonight, if we come together, we can win care for individuals. And it'll take a lot, but we can actually transform the whole system. So there are 3 specific things that we're asking you all to do tonight. You don't have to do all of them, though we would love that. But I'm just asking that you take one step that is right for where you're at this moment. Number 1, we have a petition calling on elected officials to rein in the behavior of these corporations and force them to stop denying care. Please sign it and get your friends and family to sign it. That will allow us to send a powerful message to our elected officials, and it can be your or your friend's first step getting involved in this fight. Go to the link that you see on your screen, ppls.ac/sign. We know it's going to take more than a petition to win, though, and we also know that all of us who are watching, who have been talking about this online, we have skills and we have passions to contribute to this effort. So if you want to join in on our organizing, we have a lot of ways to get involved. We have the National Appeals Team that Laura was talking about that helps people fight their denials. We do a ton of community outreach. We plan protests. We research policy, run legislative campaigns, and lots of other stuff. So if there's a way that you want to contribute with a skill or a passion that you've got, fill out our volunteer form at ppls.ac/vol. And finally, we're going to be holding an organizing meeting on Thursday, January 16th at this same time, 8 p.m. Eastern. Tonight has been great, but we've been doing all the talking. We've been talking a lot, and we want to hear from you. At this virtual meeting, you'll have the opportunity to get to know other people in this fight, share your stories, and make plans together, schemes, dreams, for how to take peaceful action to transform our healthcare system. So if you're interested in that, go to ppls.ac/organize. There are a ton of opportunities in front of us. There's defensive fights that we know we're going to need to take on, and there's more offensive fights, and this is true at the state and federal levels. We need to put pressure on our elected officials to defend against further privatization of Medicare and cuts to Medicaid. And also, public opinion of our healthcare system is at its lowest point since 2001. It's 23 years ago. And people around the country are being vocal about the pain that they're experiencing at the hands of corporate insurers. People are activated, so let's seize the moment and use this energy to make real change. Again, I want to thank all the organizations that endorsed tonight's event and have been in the trenches with us on this work the last couple of years. And most importantly, thank you for joining us tonight. When we come together, we are actually more powerful than the billionaires that we're up against. Their profits are on the line, but our lives are on the line. Let's take them back. Good night, everybody. Thank you, and talk soon.